Hello, and welcome to the Improving Safety Culture, a Phase Change Implementation Strategy webinar. This webinar is the second in our two-part webinar series on improving safety culture. It's also part of our Return to Work, Stay at Work series. We're glad you're here with us today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. This webinar is made possible through the support of the Community Grants Program through the BC government, as well as through donations and memberships. Just as an introduction of our speaker today, his name is Heinrich Bukes. Heinrich is an award-winning safety management, occupational hygiene, and environmental management specialist. Following his education in public health and environmental health in South Africa, he worked as a risk professional for one of the largest transportation companies in the world. In Canada, he went on to become safety professional for the Ontario Safety Association for Community and Healthcare, health, safety, and environmental manager at Molson, and the director of services and resources at Fiosa Miosa, as well as the director of safety and prevention at Vancouver Coastal Health Authority. He recently joined EPCAR as the HSE management system specialist. So I will hand it over to him now. Here you are, Heinrich.
Thank you, Tonya, for that nice introduction. Well, with all the formalities out of the way, we can get going straight away. I will be sharing today a phase change implementation strategy to improve your safety culture. For those of you who participated in last week's webinar, you will remember that we discussed barriers, challenges, and potential solutions to safety culture improvement. Today we will be looking at a practical approach to address these and make these solutions a reality in your work. So, let's look at the agenda for today. First, we will be doing a recap of last week's session, mainly for those individuals who couldn't be there or couldn't participate in last week's session, so that they can have an understanding of the key concepts and ideas as well, but also for those who had maybe forgotten a little bit, and it would help to refresh our memories. And then secondly, we will be looking at the steps associated with the phase change implementation strategy and how you can use that to improve your safety culture within your organization. We started the discussion last week trying to define what safety culture is. Trying to find a definition for the concept. We looked at various studies, but since each of them had a different approach, some of them came from a more social background, some of them came from an occupational health and safety background, and some of them came from a more psychological background. They defined safety culture slightly different. For our discussion today, we will define safety culture as follows. A healthy safety culture consists of shared beliefs, sound philosophy, healthy attitudes, and practices. Then I also shared with you my own personal experience with safety culture and my own observations in my career that spanned about 25 years. Back in South Africa, I worked for a railway transportation company, and there are two electrification depots under my jurisdiction, the Electrification North and Electrification South depots. These two depots had almost the exact same setup, but yet their performance was quite different. If you look at the bottom rows there, you'll see Electrification North had a lost time injury rate of 3.5, and the Electrification South depot had a much higher lost time injury rate of 15.2. Yet, in essence, they did the same work. They had the same health and safety management system in place, the same policies and procedures, but the performance was quite weaker, and I think that's as a result of poorer or a weaker safety culture. Then we looked at safety culture's impact on performance from a bit broader perspective than just my own personal observations. And I've highlighted several studies, which you can see on the slide there, that that shows that there is a good or a strong correlation between safety culture and safety performance, notably the Chernobyl disaster and the Continental Express Flight 2574. So further research had shown us that there is a strong correlation between a healthy safety culture and safety performance, as we can see from the findings of those studies on the slide there. And that brings the question, if it's known and if it's accepted that safety culture has a positive, that a healthy safety culture has a positive effect on safety performance, why isn't there more efforts around improving safety culture out there? Why don't we see it in management systems? Why don't we see it in organizational efforts? And that's really that triggered my curiosity in this field, and that's why I'm doing this presentation today, to try and bring my ideas to you folks and try to affect change in that way. Then we also looked at characteristics of organizations with a healthy safety culture. I think this slide is of extreme importance because based on this we can tweak our actions and our efforts a little bit so that we can also build a safety culture, even if it's with a bit of reverse engineering. It's a chicken and egg scenario, and based on these symptoms of a safety culture, we can actually create a safety culture by creating the symptoms artificially, and that then hopefully will improve our safety culture as well. Then we looked at barriers and challenges. We said the definition, or the fact that there's not a single definition, is a bit of a barrier because it's hard for people to strive towards obtaining a safety culture if they can't define the concept in their own minds. We looked at the level of knowledge, or the ignorance level of employers. Many employers don't know about safety culture, they don't know about safety performance. They think safety is just a cost of doing business, and it's hard for them to try and improve safety culture if they don't realize the impact of a healthy safety culture. We also said that there's a myriad of influencing factors based on the person, the situation and the behavior, and because there's so many factors, it's hard to start the journey towards safety culture. So people tend to just steer away because it's such a complex situation to address. We said there's no external drivers because it's not really legislatable, and it's not really captured in health and safety management systems in general. The measurement was identified as a barrier because it's complex and difficult, and also it is a big challenge, and a lot of people might think that challenge is simply too big to address, and therefore they will rather do nothing than to try and climb Mount Impossible. I also presented some solutions to try and improve safety culture by looking at organizations with a healthy safety culture. I suggested some reverse engineering, which include the improvement of leadership, management and commitment, to increase the involvement levels throughout the organization, to improve occupational health and safety communication, to encourage near-miss reporting, to focus on hazard awareness. As you may recall, in last week's discussion, I mentioned how much more aware the supervisors and the workers of the northern electrification depot were than the ones in the south. That awareness rubs off in your motivation and your activities, and that really can make a difference in the safety culture. We also said that good housekeeping will improve safety culture. A stable workforce is important, so therefore you have to have good personnel selection, job placement and promotional procedures within your organization. You have to really have top-notch occupational health and safety training. Remember that people can only be as safe as to what they are trained. They need to understand the hazards, they need to know their procedures, they need to know the general rights and responsibilities that occupational health and safety entails. And then you also have to have a really good orientation program. We find that the better the orientation program, the better the safety culture, because people are taught the right way from the beginning, because once they fall into a habit of doing something in a certain way, that's really hard to change it. But if they do it in the right way from day one, they seem to stick with that, and that become the norm and the habit. So you will have to expand your health and safety management system by including safety culture as a specific element within your management system. It should not be scattered throughout, because then you can't focus on it. By having it as a specific element, you can have specific measurement criteria, you can set targets and goals, which is very important when you want to improve safety culture, because if you don't set a specific target, there's nothing for you to work on specifically, so it tends to get lost in the big rat race of safety. You have to have specific focused action plans based on your weaknesses, and you have to include it in part of your audit and management review, so that it can be part of the continuous improvement regime of your health and safety management system. You have to therefore take a deliberate action by implementing a phase change implementation strategy. Remember, safety culture is established over years and years, and it won't change overnight. So you have to be smart about it, you have to be patient, you have to be persistent, and you have to have a long-term plan. Now, be prepared to work on this for 3 to 5 years before any significant changes will materialize. Maybe sooner if you are very committed, and if you have a fairly small organization that can change a bit quicker. But for the standard fairly medium to large organization, it does take quite a bit of time. We will now move on to the second item on our agenda today, which is a phased change implementation strategy to improve safety culture. This phased change implementation strategy is designed to provide a practical approach to address the barriers and challenges associated with safety culture. It's designed to break down safety culture in more understandable chunks, so that you can get your head around it, define it a little bit better, quantify it a little bit better, so that you can actually make change to those chunks. And then if you make change to the chunks, that will affect the whole and improve safety culture overall. It's also intended to address the measurement difficulty associated with safety culture. You will see in the third step of this implementation strategy, we're going to be measuring your safety culture by looking at 6 specific areas, and you're going to be developing a index for your safety culture performance by gathering data on 6 areas, and that way you can improve safety culture, because you understand the subcomponents in a quantified way. It will also address the too big challenge paradigm associated with safety culture. In other words, we can show people the path that they need to take to improve safety culture. We're not just showing them the end goal, we're actually showing them the path, and that I hope will provide motivation for people to try and attack the problem. So it's to provide a simple solution to a difficult and complex problem through this phase change implementation strategy. So let's look at the different phases. First, you have to establish a vision. We'll discuss each one of these steps in more detail in the later slides. This is just to give you an overview of the phases. Then we have to secure senior management commitment and employee involvement. Then we have to gather the data or actually measure safety culture. Then we have to establish a safety culture performance index and profile. Now both of these things are critical um, because without that you can't really set proper goals or targets. The index is the overall number or concept of how well are you doing. That's important because the profile will vary, but the idea is to improve your index. And the profile is important so that you can set specific targets on your poor areas. Phase number 5 is develop your change drivers. We'll speak more about that when the slide comes. Then we'll implement the strategy, which is what the whole thing is really about. And then lastly is we will implement a strategy that continuously track performance and evaluate the effectiveness. This is quite important as it's a long-term process. It's easy to lose track. 6 months will go by and then nothing has happened. So it's important to continuously track and monitor progress. So let's look at the first phase, the first implementation phase, a little bit closer. It's to establish a vision. How do we do this in practice? It's very simple. We set a policy. Safety culture is no different than other health and safety elements, such as chemical safety or contracted management or confined spaces. We have to have a policy. It's the only way we know where we're going. It's the only way we know what we want to do. So we have to sit down and define or write down a policy around it. In that policy we can establish goals and objectives, and it doesn't have to be those listed on the example there. That's simply an example. There's various different goals and objectives that would lead to an improved safety culture, and you can also include governing procedures for all the steps that you're going to take. For instance, how are you going to communicate, how are you going to do surveys, how are you going to do sampling, and so on. That can all be captured in this document. So by establishing a policy and procedures, you can have a practical approach to change or to start change in your safety culture. The second phase in this implementation strategy is to secure management commitment and employee involvement. As with any other health and safety program, it's impossible to make change if you don't have the support of your senior management team. If they are not driving it, you won't be driving it as a safety professional. It doesn't really matter how good you are, you need their commitment and their involvement in the process to really affect long-term change. So it's important to note that the CEO has a very unique and influential role in any initiative, and specifically even to a larger extent when it comes to safety culture, because they can champion for health and safety within the organization. They can influence the board's agenda. They can get specific topics on the agenda for discussion. They can set safety performance metrics for the safety or the senior leadership team. They can provide all the resources required to improve safety culture, and when they involve joint health and safety committee members or other workers in health and safety matters, that really sets the tone for culture improvement. If the workers see that it's important to the CEO, boy oh boy, they really get the message, and they really do whatever they can to improve safety culture. So as you can imagine, it's extremely critical for your CEO to be on board, or to get your CEO on board in this initiative. It is sometimes forgotten the importance of strong leadership when it comes to health and safety culture. There's more to a good leader than just a good manager or just a good boss. A good leader needs different attributes or different characteristics. And I think Aristotle has summed it up really nice. For those of you who don't know who Aristotle is, he was a Greek philosopher who lived 400 to 300 BC. Many consider him as the smartest man to ever walk the earth. Also known as the father of logic. So very notable figure. And I've read many of his works and I have a huge respect for him. But one of the things that he had said around motivation and persuading people to follow you is the leader have to have ethos, pathos and logos. Now ethos is basically he has to have an ethical character. In other words, his character should be without blemishes. People need to trust him. He needs to be a man of his word. He needs to have reached heights in his career so that people can look up to him. So he has to have a strong ethos. He has to have a strong pathos as well, which is basically passion and care. They want to see that the leader really cares about them, and they want to see that he's really passionate about health and safety. If you can recall in the previous discussion, in the previous session, I spoke about the manager of the department head in the northern electrification depot, and how he was so much more passionate than the one in the south, and how that really was a trigger for the safety culture within that northern electrification depot. And then that leader needs to have a logos as well. In other words, his approach needs to be logical. People is attracted to a logical plan. If they can see the plan, if they can see the path, they tend to follow that leader. So how do we bring this all into practice? We can set up an ad hoc steering committee. It's much better if a committee drives this change than an individual. It's important to include all the key stakeholders in that committee. So you have to have union leaders, you have to have HR leaders, you have to have safety individuals, you have to have people from the floor, you have to have managers, you have to have operational people, all in the discussion, so that it's their plan, in other words the organization's plan, and not the safety department's plan. And that's the way you get buy-in and involvement for your initiative. So phase 3 then is gathering the data required firstly to establish your profile and your index, and then to develop an action plan from. The neat part of this is that it's quantified, it's defined, it helps you to understand what are the factors that influence your safety culture. The first one there, as you can see, is management, leadership and commitment. It's the beginning point. Without that, you won't go anywhere. The second one is your involvement levels throughout the organization. Without involvement, safety culture becomes a paper exercise and not real. The third one is your existing risk levels. You want to see that these risk levels are actually coming down. Organizations with a good safety culture has fairly low risk levels typically, depending on where in the journey they are. But if risk levels do not decrease, then you don't have a healthy safety culture. Number 4 there is safety compliance. In other words, to what extent do people follow rules and regulations around safety. Safety performance is your lost time injury rates. And then number 6 there is workplace trust and morale. You measure that by doing your perception surveys. In some consultants will actually do that perception survey and sell that off to employers as measurement of safety culture, which it's not. It's maybe a measurement of safety climate, but it's not the complete picture. To have the complete picture, you have to have all of these elements in some way, shape or form to get the complete picture. And I anticipate, as we learn more about safety culture and factors that influence that, this list of 6 might even expand a little bit and include other factors as well. The first of the 6 areas of data gathering is data around management, leadership and commitment. Some of the ways that we can quantify this leadership and commitment levels is by looking at health and safety goals. Do they set them? Do they have a health and safety management system in place, like OSAS, CORE, or ISRS? That's the logos part of the requirements of their makeup. Do they monitor progress? Do they know where they are? Have they assigned roles and responsibilities? And do they hold people accountable? So by looking at those factors, we can have a pretty good idea to what extent are they committed and involved, and maybe get some clue around their leadership skills as well. The second step in the data gathering, or the second area in the data gathering process, is looking at the involvement of all levels within the organization. That includes board members, department heads, supervisors, workers, the Joint Health and Safety Committee, and contractors. Now, how do we determine what the involvement level is for each one of these levels in the organization? Well, it's different. For instance, department heads, to what extent do they include health and safety in their meetings with their supervisors? Is it a agenda topic? For the supervisors, for instance, you're going to look at crew talks. To what extent do they have crew talks? Do they include safety performance in their workers' performance matrix, and so on? So as you can see, depending on the level, it will vary, but there's a way to figure out what the involvement level is. For workers, it's maybe something as simple as making suggestions, reporting hazards, and near misses. If you see a lot of near miss reporting, you would know for sure that workers are very much involved within the organization when it comes to health and safety matters. The third area that you will be gathering data in is the existing risk levels. You will have to look at your inspection reports, your occupational hygiene surveys. What do they say? You have to look at your risk assessment reports. You can gain a lot of information from your job task analysis. You can review your Joint Health and Safety Committee reports and the minutes of their meetings, and you have to establish then to what extent is the risk uncontrolled within your workplace. And the way to think about that is to think about how much of the workforce is exposed to that particular risk. So if you look at the overall picture, you can see that risk levels are coming down based on the exposure. So you're either going to be having less severe risks, or risk with a lower level of severity, or you're going to be exposing less people to that risk. It's a different way of doing it. The fourth element that you'll be looking at in the data gathering is your safety performance. Now, luckily, this is something that's very easy to track and very easy to quantify. Basically, you'll be looking at your lost time injury rate, or your frequency, and you'll measure that against your industry average. So let's say you are a brewery, you'll be comparing your lost time injury rate against those of other breweries, or the average of other breweries. And you can get that information from WorkSafe BC or WCB, depending on your jurisdiction. You can also look at your lost time duration or your severity. In other words, how long are people off when they get injured. You can also look at your insurance rate cost or your claim cost. As another indicator, or the combination of those. And if you are maybe you have some US operations, and then you'll be looking at your TRIF levels. But very easy to find and very easy to compare, because you are just comparing it with industry average. And the idea is that you will always be below industry average. If not, then something's wrong and you need to tweak something there to ensure that you keep on the journey towards improved safety culture. The fifth element of data gathering is safety compliance. Now, here you want to establish to what extent do people follow the safety rules and regulations as set out by the company and by the government in regulation. So some of the areas that you can use to gather the data is your workplace inspection reports, once again, your accident investigation reports, job task observations as well, and then you'll determine your non-compliance activity by looking at those reports. If you have a behavior-based safety program, you can also use the tallying mechanisms of that program to identify areas in which people follow safe work procedures, where do they do well and where do they struggle a little bit to follow the rules. And last but not least is the sixth element of your data gathering. That is your workplace trust and morale. You do that by doing a safety perception survey. Now, doing the survey is not that difficult, but there's many potential pitfalls in doing the survey, so make sure you know what you're doing, or I recommend doing that through a third party so that you can get accurate and correct data in order to ensure that you are on the right track. But some of the things that you would consider is your absenteeism levels, labor grievances, and the number and amount of safety recommendations to try and establish what your level of workplace trust and morale actually is. Well, the fourth step in your implementation strategy is to establish a safety culture performance index and a safety culture profile. Now, during your measurement, you've been able to quantify the different components of the overall safety culture picture. And those components, just once again, would be your leadership, management and commitment levels, your involvement levels throughout your organization, your existing risk levels, your compliance levels, your performance levels, and mutual trust and morale. Your index provides you with a big picture concept. In this particular instance, you'll see that the index for this organization was 46, which is sort of average. Average would be 50, but you can see by their profile that the areas that they need to be working on is the involvement levels and mutual trust and morale. So it doesn't surprise me that there's a good correlation between those two areas, because obviously if you're not involved, you won't trust your management team. So a very common type profile that we see in this particular case. The key here, however, is not to have a accurate measurement, but a consistent measurement, so that you would know if you're improving or not by supplying the same measurement criteria on an annual basis. Now, the fifth phase in this implementation strategy is to develop your change drivers. Now, I can't really say enough about this, because I've seen countless initiatives like this fail simply because there's no drivers. The idea is there, the will is there, the resources are there, but there's no specific drivers. So before you actually can make a change, you have to make sure that you have drivers to drive the process forward all the time. So some of these drivers include good communication and marketing strategies, feedback processes. It's very discouraging for employees to participate in things like surveys, but they don't really know what's happening as a result or why certain decisions are being made. So you have to make sure you have strong feedback processes. Um, Develop collaborative problem solving mechanisms. If you involve people in solving problems, they have automatic buy-in in that solution, so they become the driver, they become the mechanism through which change happens rather than you. So it's absolutely critical that you have collaborative problem solving mechanisms in place. Make sure you are patient and know that changes needs to be incremental, small changes, continuous changes. Don't try to make too big a change, but make sure that you track those small changes and celebrate in the small successes. You might also want to develop a behavior-based safety program if your work activities or your business activities is such that a behavior-based safety program would be suitable, or it would be compatible with your activities. Try it. It's a difficult program to implement, lots of challenges associated with that, but if it works really well, and you can really reinforce your positive safety behavior by using behavior-based safety. And then you have to monitor and track progress consistently. As I mentioned before, with any long-term initiative, it's very easy to go off track. Before you know it, a year or two is gone and you haven't really moved forward. So that continuous tracking towards progress becomes very important. Now the sixth phase is to implement the strategy. It's important to remember that the initiative activities are not the same as the actual activities that defines safety culture. These strategies or these activities are the things that you have to develop so that you can govern the initiative, to provide a structure that management need to do it. So these are simple things like scheduling meetings, monitoring meetings, develop an identity for the program or the brand, develop early and proper communication mechanisms and criteria. If you have a large facility, a large organization with many sites, you can pilot the initiative in a specific area or at a specific depot to see how well it works, to see what doesn't work, and then tweak your program a little bit before you roll it out to the wider organization. It includes things like training programs, delivering methods, scheduled training sessions, and collection methods, and so on. So quite key in the overall success of the strategy is a nice, good, solid implementation plan. And lastly, the seventh step is to implement a strategy that continuously track performance and evaluate effectiveness. We've spoken about this a little bit before, but it's important to have the right tracking mechanism, or at least the right tracking criteria in mind when you evaluate your progress or when you track your progress. You must remember that the ultimate goal is to lower injury rates. So if all of these things don't lead to lowering of injury rates, then you're probably not doing something right. You might need to tweak it as time goes by to make sure that these injury rates continue to come down. You have to evaluate the implementation strategy's features, in other words, not only the outcomes, but you also have to see how well does my communication methods work, how well does my branding work, for instance. So the specific features around the strategy needs to be evaluated as well, not only the overall injury rate. And it's important to look at each one of these elements individually. And there's some suggestions there as to how frequent that should be. So it's a good idea to look at your leadership, management, and commitment on an annual basis. It's a good idea to look at your involvement levels on a quarterly basis, your compliance levels also at a quarterly basis, your performance levels as well. And then annually you want to look at your hazard assessments to see if your risk levels are actually coming down, and also your perception survey to see what the safety climate of the organization is, and to what extent do people believe that they work in a safe place, and how committed they are to the safety culture improvement. Are they equally involved than you, or do they see it as something that is just another management activity that's forced on them? So at least look at that on an annual basis. So continuing with the implementation strategy, the seventh one, you have to evaluate progress towards your policy goals and objectives. Remember, we've set a policy with specific goals and objectives, so you have to measure against those policies and goals as well, and then you have to track performance against those set indicators on a continuous basis. So in summary then, we said that there's 7 phases associated with this implementation strategy. The first is to establish a vision. How do we do that? By setting up a policy with specific goals and objectives, with governing procedures and assigned roles and responsibilities. Then we look at securing, the second phase is securing management commitment. In there we looked at to what extent are managers involved, to what extent do they set goals and objectives, do they assign roles and responsibilities. Employee involvement is things like making suggestions around health and safety, showing up for training, being involved in discussions. The third phase then is data gathering, and we discussed those 6 areas of relevance. In that area, it's important that all 6 areas are included. Different ways and mechanisms are possible to look at it, but the main idea is that you involve all of them, and maybe even more if you can find a reason to include something else. Remember, it's not about accurate measurement, but about precise measurements. You want to be able to repeat that measurement on an annual basis so that you would know if your program is actually improving or not. Then the fourth phase is to establish a safety culture and performance index and profile. You use your index to track overall performance improvement or deterioration, and you use the profile to actually develop your action plan. Phase 5 was develop the change drivers, which is fundamental to keep on moving the initiative forward. Otherwise the program will become stale, people will lose interest, and the whole thing will be a flop. Then you implement the strategy. Important to build the infrastructure around it. Make sure you have a good logo, have a good brand to keep people excited. And then lastly is you have to implement a strategy to continuously track performance and evaluate effectiveness. Many organizations will forget that last phase, and 2 or 3 years down the line they will realize that all the efforts has been in vain because they haven't tracked things, and things has become stagnant over time. So very important phase, that last phase. So that concludes our discussion for today. There's some more slides that you will see following this one, which is basically some references and suggested reading. I will just keep the slide up for a moment so you can take a look at that. I believe the slides will also be available for download. So if you seek further reading opportunity or further resources, please feel free to download the presentation.
Great. Thank you very much, Heinrich. That was wonderful. Let's see. Everyone feel free to type in any questions you have for Heinrich about the session. We do have one question. Someone asking, please explain risk levels and why they would go up if safety culture scores go down. Oh, sorry. Why they would go up if safety culture scores go up. And they were referencing slide 25, the graph you had.
Yeah, sure. Yeah, that's a non. The correlation is negative there. So your risk levels will actually, I'm going to go back to that, to this particular slide there. If you look at that, the risk levels, the indication of the bar there is the lower the risk, the higher your score. So a very good question there. So when you look at a lower risk level, you will have a higher score. So it's an inverted type relationship.
All right. And then someone asking, your approach seems to be focused on more labor-intensive occupations with high physical demands. What would your advice be for organizations that need to encourage more safety culture around more sedentary offices, so like people who are sitting a lot, repetitive strain injuries, those types of issues? How would you encourage change for that?
Well, you would have to do the measurement first. You have to establish your profile to see where your problematic areas are. So if you do your assessment, you've done your measurement, and you see that there's low involvement levels. In other words, the staff doesn't really participate in the health and safety initiatives, or there's no recommendations from the floor. Then you would know you can change it in that way. If you look at things like trust, if you look at management commitment, it all depends on what's causing that that poor safety culture, and you can do that. You can only do that when you actually measure the safety culture in the organization and establishing a profile. So the answer is look at the profile, and that will give you some guidance as to how to change.
All right, and then someone referencing the slide that you have showing right now was wondering how the numbers on the horizontal axis were determined and what measurement system was used.
Well, this particular set of data was developed by myself, and it's if you look at the different slides, when you look at leadership, management, and commitment, involvement levels, that sort of give you an idea of what were the factors that you looked at. Like I said before, it's not about how accurate you are, but it's about how precise you are. So you can establish your own set of criteria on how you're going to measure leadership, management, and commitment by looking at, do they set goals, do they communicate properly, do they participate in, do they go to the health and safety committee meetings, for instance, once a year or once a quarter, and then use that as your criteria. The important thing is that you apply that same criteria every time you do the measurement. So the criteria itself is not that relevant, but the fact that you apply it persistently every year, that's the important factor.
All right, and then someone asking, you've worked in healthcare. What do you think is the biggest barrier in healthcare with multiple stakeholders?
To change safety culture, or in?
Yes.
I would think logic. I would think that the understanding of leadership of what health and safety really entails would be the biggest barrier. So if you look at the profile once again, probably once you've analyzed it, you'll see that there's a problem in the leadership and management understanding of how safety should be practiced. But that's just my opinion. Before you actually look at the numbers, it's hard to make that call. But if I have to guess, that is what I would identify as the big problem.
All right, and that seems to be all of our questions, and we are just about at time anyways. So I think we'll go ahead and close. Thank you very much, Heinrich, for the presentation, for both of the presentations, actually. They were quite wonderful.
Thank you, Tonya, and everybody have a great long weekend.